of NTDs. GTMP, Global Trachoma Mapping Project. HKI, Helen Keller International. IOCC, International Orthodox Christian Charities. ITI, International Trachoma Initiative. KIMRI, Kenya Medical Research Institute. LF, Lymphatic filariasis. MDA, Mass Drug Administration. MDG, Millennium Development Goal. MDP, Mectizan Donation Program. MOHCC, Ministry of Health and Child Care, Zimbabwe. MSD, Merck, Sharp, and Dome. NatPharm, National Pharmacy, Zimbabwe. NGDO, Non-Governmental Development Organization. NGO, Non-Governmental Organization. NTD, Neglected Tropical Disease. OCP, Onchocerciasis Control Program. PCD, Partnership for Child Development. RSC, Rockefeller Sanitary Commission. SAFE, Surgery, Antibiotics, Facial Cleanliness, and Environmental Improvement. SCI, Schistosomiasis Control Initiative. STH, Soil Transmitted Helminth. TT, Trachomatous trichiasis. UN, United Nations. USAID, United States Agency for International Development. WHO, World Health Organization. Under the Big Tree. Nearly 24 diseases have been designated neglected tropical diseases. The most prevalent are river blindness, trachoma, lymphatic filariasis, schistosomiasis, and intestinal worms, roundworm, whipworm, and hookworm. These 5 NTDs are the focus of this book. NTDs exist in at least 149 countries. This book concentrates mainly on countries in Africa, which shoulders the heaviest burden. In today's big, bold effort to end NTDs can be found many heroes and many inspiring stories. Here are a few of them. Chapter 1, Crisis and Collaboration. On the second day of a conference in 2012, Dr. Massiton Dembele took the lectern. Her fellow presenters in the main ballroom of La Palm Royal Beach Hotel in Accra, Ghana, were several dozen neglected tropical disease (NTD) program managers from countries throughout Africa. These men and women directed their government's efforts to treat, prevent, and in many cases eliminate a group of parasitic and bacterial afflictions that, although they affect more than 1.5 billion people worldwide, have historically been greatly ignored. Turned-in eyelashes that scratch the cornea, relentless itching due to millions of worms in the skin, blindness, bloody urine, enlarged scrotums, elephantine legs and feet, not to mention anemia, malnutrition, stunted growth, stunted cognitive development, and increased risk for complications from diseases such as HIV/AIDS. These are but a few sequelae of various NTDs, whose sufferers often drop out of school and live on the margins of society, sometimes stigmatized and abandoned by their families. NTDs are both the source and a result of poverty. The 1.5 billion people who suffer from them are among the poorest in the world. One after another, the program managers reported on disease prevalence, funding gaps, and current concerns. Smartphones would help us better share data, said one. A single vehicle for our entire program isn't enough to reach the remote villages, said another. 2 months into my job as the CEO of the End Fund, I had come to the conference to listen and learn. The End Fund itself was a newcomer to the space, founded in early 2012 by the Dubai-based private investment firm Legatum and its philanthropic advisor. Geneva Global.